Hi, Dr. Bernard here. This video is based on a case published in literature. I don't, and I'm not going to, rag on chiropractic. If you need chiropractic care, see a chiropractor. Don't do it yourself. Very generally, if a licensed professional exists for some function, you hire that licensed professional when you need someone to perform that function for you. And in America, chiropractors are licensed by the state. If you don't need to see a chiropractor, then don't see one. I'm telling you this story to teach you medicine and anatomy. A mom did a chiropractic maneuver on her own neck. This is what happened to her brain. CN is a 34-year-old woman presenting to the emergency room, foaming at the mouth. Paramedics tell the admitting nurse that they saw her complain of headache and nausea in the ambulance before she had a seizure, and after it was over, she was completely unresponsive. CN couldn't ever remember a time in her life when she felt healthy. Growing up, her parents never taught her hygiene because they didn't really practice it themselves. CN didn't learn to use toilet paper until she was a teenager, and when she did learn about it, her usage usually wasn't complete. It'd get swampy, and she'd get deep in and scratch the whole area. And because her hygiene wasn't optimal, her hands would touch all kinds of surfaces and it'd get very many people ill. But the person who got the most ill from this was herself. Bacteria would get from her hands into her urinary tract, and the resulting complicated urinary tract infection would just feel horrible. She'd have a fever. Her sides would hurt in a way that it would make her eyes water, and it would bring her down to the ground. CN was always able to get antibiotics for this, though, and finally, a doctor was able to correctly identify her poor habits based on her smell in the clinic. And once she was finally able to clean it up, things were looking great for her, but only for a few years. One day, CN realized that she couldn't remember the last 6 months of her life. Every morning she'd wake up and she didn't know where she was. She didn't know what day it was and she didn't know where she had to be. And her grades at school just suffered. CN lost most of her friends during this time because everyone just got frustrated at talking with her. If she even showed up in the first place, she didn't understand what anyone was saying, and it gave them the impression that she just wasn't listening. And sometimes she would forget to respond for days, so people just gave up. No one wanted to be friends with someone who does that all the time. Finally, one day, CN had a urinary tract infection that brought her into the hospital, but something was wrong. This wasn't related to her poor habits with toilet paper and touching things. She was clean now. Rather, CN had somehow developed type 1 diabetes. This is a time when the pancreas is damaged and no longer makes insulin, which is a hormone that's released after you eat to tell the body's cells to take in sugar from the food that you just ate. But when there isn't any insulin being made, the sugar stays in the blood, and this causes organ damage. The nerves start to shut down, the kidneys fail, the feet might need to be amputated because sores develop and they don't heal. The brain can't function in this environment, so executive function becomes impaired, explaining why she wasn't being her normal self. But her diabetes also explains this particular urinary tract infection. In extreme hyperglycemia, hyper meaning high, glyce from glucose referring to sugar, and emia meaning presence in blood, high sugar presence in blood, sugar gets into the urine. And because sugar grows bacteria, when sugar's in the urine, it predisposes one to horrible urinary tract infections, just like the one that CN had. But her problem didn't stop here. In the hospital, CN's infection wouldn't respond to antibiotics typically used for UTI. As the bacteria started spilling into her blood, it caused her body to send an immune response. Kind of like how when you get a cut, it becomes swollen with fluid and warm. When bacteria floats around in your blood, your entire body becomes swollen. The blood vessels dilate, dropping blood pressure so much that the organs can't get blood anymore. Without oxygen, the organs fail. And this is what was happening to CN, and they found out why. The sugar in her urinary tract had grown a rare bacteria not often found in UTIs, and so they elected to change her antibiotic to one that can destroy this particular bacteria, and things seemed to be okay for her. But at home, discharged from the hospital, CN seemed okay at first. She went out for a walk, and suddenly her left knee and calf started hurting so bad that she collapsed to the ground. Back at the hospital, doctors found that CN had partially ruptured tendons in her left leg. A 20-year-old woman shouldn't have this happening, but when the medical team looked, they found that that antibiotic that was given to her for the UTI can cause tendon rupture. It took months for her to recover from this physically, but mentally, she never recovered. CN was never sure if the pains in her left leg were real or phantom pains, but even worse, this experience gave her health anxiety attacks. As the years passed, CN's anxiety resulted in chronically high blood pressure. When she'd see the doctor, it just seemed that her blood pressure was always higher than normal just at that visit. She tried to tell the doctor that it wasn't normally this high on any regular day. She was just afraid that that doctor was going to tell her that something new was wrong with her, that it is, no doubt, a catastrophic illness that will for sure shorten her life, and that they absolutely must start some new medicine for her because she has it, and that new medicine will do what the last medicine did, cause terrible, permanent damage to her body. But in reality, her blood pressure really was chronically high, and this would cause her to have terrible headaches. CN had read online about how sometimes headaches are caused by misalignment of bones in the neck, and that when these bones push down on nerves going into the skull, well, this is one cause of headache. In her mind, this was very clearly the cause of all of her problems. When she watched videos online of how necks get adjusted, she got the idea of how to do it herself. She didn't need medicines. She didn't need to hire an expensive specialist. She touched her neck and knew exactly what to do as she laid her head down on a staircase and rotated her body. Immediately after cracking her neck, the headache that CN thought she had simply went away. This was like a miracle to her. She would keep doing this day after day. Most of the time, she knew in her mind that she felt so much better. But one day, something was wrong. At the top of the stairs, CN held her head down. She put her body in the position that she always did. She turned her head left and twisted her body. Immediately after the cracking sound, CN didn't feel well. She felt like her eyes were wobbling in her head. In the bathroom, at the toilet, CN immediately emptied her stomach. Her headache didn't get any better. She started pacing around because no matter what, she could feel that there was a throbbing sensation that was wrapping around her head. She could see her heart beat in her field of view, and as the minutes passed, she'd see sparkles come in and out as things started to get dark. She tried laying down, but then finally, she didn't get up anymore. When her husband finds her on the floor, CN was shaking as she's brought to the emergency room where we are now. At examination, doctors immediately noticed that CN had an extremely high blood pressure. She was still conscious for a few minutes, but she wasn't able to speak, and then she became unconscious. Doctors and her husband had no idea what happened. They didn't know what she was doing beforehand, but clearly, something had happened to her brain. One thing that can be done is to see if something happened to the blood supply going to her brain, and we can visualize this. There's two things to know. First, blood going to the brain is oxygenated. Nature tells us how important the brain is because it's one of the first places that blood goes to once it leaves the heart. If something stopped that blood flow, then CN's brain was being starved of oxygen. This will cause immediate, permanent damage. But why would that happen? And that's the second thing. Blood goes to organs via arteries. Anatomy tells us the possibilities. 1. Arteries can be blocked, usually by a blood clot. 2. They can narrow because of a plaque that can obstruct blood flow. 3. They can bulge out and pop, something called an aneurysm. Or 4. The inner lining can rip apart and blood can tear inside, separating the arterial layers and then clotting, blocking blood flow. Doctors inject a dye while running a CT scanner on CN's head to see if they can visualize where problematic blood flow might be. When they do this, they find that a very short segment of an artery in the region where CN's skull meets her spine in her neck was thickened. This could be a problem, but maybe not. But other than that, everything else was normal. In the intensive care unit, CN would respond to stimuli. They would squeeze her trapezius muscle to get a response. But as the hours pass, no amount of squeezing would yield any feedback. Shortly after her arrival, a CT scan revealed that a huge portion of the front right part of her brain was bleeding. Hey, I got a quick question. If you like this video, I wanted to let you know I publish once a month, and I try my best to make each video worth your time. I've been making these since 2017. If you do find this valuable, I'd love it if you subscribed and come back to see my next video too. The brain is covered by thin tissues that protect it. Between these layers is something called the subarachnoid space. The CT scan found that CN's brain was bleeding right into this area, but there was more. The brain has fluid-filled cavities on the inside that serve as a communication network called ventricles. There's 4 of them, and they're interconnected. There was extensive bleeding into CN's ventricles, so much so that her brain was swelling. It was distorting, and parts of it were getting pushed off to the sides while getting crushed up against her skull. If imaging showed that her brain arteries were okay, why is her brain bleeding like this. The vertebral artery originates from the subclavian artery, which comes from the aorta, which is the largest artery in the body where blood emerges from the heart. The moment that blood leaves the heart, one of the first places that it goes to is the right subclavian artery, which goes to the right vertebral artery to head directly to the brain. The problem is the vertebral artery enters into the cervical spine and it passes through these holes called transverse foramen. As you go up towards the brain, you start to notice all these delicate structures that receive blood from this artery. And because it's built this way, if an accident happens, terrible things happen to the brain. If trauma is applied to the vertebral artery, such as a twisting motion that outside the body looks like a chiropractic maneuver on one's own neck, then the shear stress can cause a tear on the inside lining of the blood vessel. Blood rushes into this tear. At first, every time the heart beats, it packs blood in, ripping the layers of the blood vessels apart until it's so far in that the heartbeats can't rip in any further. This is called an artery dissection. And the blood that's already in pools. It starts to thicken and becomes like a gel. This narrows the lumen or inside hole of the blood vessel. And it was maybe the one thing that doctors saw in the emergency room when they tried to check the blood flow going to her brain. The problem is, by the time you get to the vertebral artery segment in the brain, the arterial walls are thin. Everything's delicate. When handled without care, it can easily rip. The end of this is massive bleeding. When bleeding happens in the ventricles, the brain can swell and crush against the skull. Other parts of the brain will twist and get shoved into the base of the skull. These are called herniations, and this was observed to be happening to CN on her CT scan. Headache and nausea are common in subarachnoid hemorrhage. The pressure on the brain starts to cause one to become sensitive to light and cause one's neck to become stiff, something that may not be out of the ordinary for CN, given the movement that she did with her body. In her case, as blood moves down towards her spinal cord, it irritates the surrounding nerves, causing neurologic issues. And as the minutes and hours pass, more and more permanent damage is being done to CN's brain. But this should be really weird. Looking at the anatomy of how the arteries are laid out in the cervical spine, the one thing that we have to ask is, how often does this happen? You might be familiar with how sensitive the neck can be. At one point, you may have stretched funny and then felt a sharp tinge in your neck, and the next thing that you know, you pulled something and your neck is stiff for the next week. And that's just muscle. There's nerves and major blood vessels here, the latter of which, something funny happening can be fatal. When we look in the literature, we find that sometimes, and this is very rare, people will just move their head and it's over. Sudden headache with severe nausea, ending in massive brain bleed so bad that the blood supply is just lost. Blood floods in, never circulates again, and clots, starving the brain of oxygen. A case series published in 1981 described 8 patients. One was a 38-year-old woman who turned her head while driving, and immediately the back of her head had a sharp pain, and she suddenly couldn't see while she was on the road. In the hospital, she had trouble moving her right arm and her brainstem started shutting down. The brainstem controls breathing, and they knew hers wasn't working anymore because they saw her become unable to breathe properly. At autopsy, they found that the middle and back parts of her brain had been bleeding because of an injury to the right vertebral artery. This wasn't the only one. Another 58-year-old man turned his head while backing up his car. He proceeded to lose vision in both of his eyes for 5 seconds. He then got the worst headache of his life and started emptying his stomach from his mouth. 2 days later, he was unable to move his eyes, and imaging found that his left cerebral artery had dissected, but luckily, he was still alive and taking medication for this 11 months after this had happened. One important takeaway from this paper is that blood vessels in the neck can break at any moment, starving the brain of oxygen and causing permanent damage. But everyone watching this knows that this isn't the norm. I'm not breaking any vertebral arteries doing this right now. So what would predispose someone to have this happening to them? We have a little better of an idea now versus 1981. One reason that's important, but not everyone is going to have this, is connective tissue disorder like Marfan syndrome or an Ehlers-Danlos syndrome. These can impact the integrity of the arteries and could predispose one to problems like dissection and aneurysm, but CN didn't have either of these. The body has the amazing ability to adapt. In context of disease, we call this adaptation compensation because it's the body making changes responding to a pathological situation that could be remedied if a treatment is available. Do you remember CN's hypertension? Well, chronic hypertension causes permanent negative body changes. The heart's a muscle. When pressure is high all the time, we can guess that the heart is working harder than normal. What happens when muscles work harder than normal? They get bigger. They hypertrophy. If you're talking about biceps, triceps, quads, glutes, lats, maybe you do want hypertrophy. But when we're talking about the heart, we don't want that. Thicker walls of the heart means that it's harder to eject blood to the rest of the body, and cardiac hypertrophy is permanent. You can't just let the heart rest like you can skeletal muscle, because that means your heart stops beating and you're not alive anymore. This is how the heart compensates, but it's not the only thing that becomes jacked. When pressure is chronically high, shear stress along the arterial lumen is increased, and arteries are vascular smooth muscle. If we've already established that the heart muscle hypertrophies because of chronic hypertension, then we can also say that the arterial smooth muscle will also hypertrophy with the increased load appearing in the form of greater shear stress. The resulting vascular remodeling causes the arteries to become more narrow and harder, but CN also had diabetes. Regardless, type 1 or type 2, the metabolic consequences of blood sugar disorders predisposes one to atherosclerosis. Athero from Latin based on Greek, referring to growth, or the appearance of what we now know as fat, and sclerosis, also from Greek, meaning a hardening of the arteries due to fat deposits. All of these bodily changes put CN at a greater risk of dissecting her vertebral artery, especially when self-performing a very physically rough maneuver on her own neck. Typically, when light is shined into the eyes, the pupils will constrict so as to react to the amount of light. This is a reflex by the brainstem. When the pupils don't react, it means that something is wrong with the brainstem. And in CN, her pupils didn't react. Given that this was happening with a CT scan showing subarachnoid hemorrhage, and brain herniation, all of these are very bad signs, and things didn't get better for her. This didn't have to happen. CN had a lot of past negative experience with medicine. She had a significant past medical history of recurrent UTI, type 1 diabetes, fluoroquinolone-associated tendinopathy, hypertension, anxiety, and possible autoimmune disease. If you take the chiropractic part out of this, her turn to self-performed therapy was especially high risk, particularly given all the risk factors that she did have. To say that she didn't know may not be entirely correct. We see it in movies and TV when someone snaps somebody's neck and then they collapse to the floor. It's just in this case, hers wasn't a movie. It wasn't a joke. She actually did collapse and she was never able to get back up again. At autopsy, evidence of injury on the left side of her neck were found. When they looked at her heart, they saw that the left ventricle had been starting to hypertrophy consistent with her chronic hypertension. Diffuse cerebral edema was found with subarachnoid hemorrhage at the brainstem and the cerebellum. Blood clot was found in the right vertebral artery that was going into the right base of the skull, and this made sense because her injury was on the left side, so there was a contralateral impact given the nature of her maneuver. They found that her brain did herniate, that it did crush down into the base of her skull, and another part started folding in on the brain, causing the blood supply to those areas to choke off. All of this confirming that she did have vertebral artery dissection due to self-chiropractic cervical spine manipulation that resulted in fatal subarachnoid hemorrhage and cerebral hemorrhage. One of the most comprehensive warnings that I can give about this is that everything has a risk to benefit ratio. If you don't need to do it to your body or put it in your body, then don't. On a macro scale, there's a risk on doing studies. On the clinical side, we have good data on interventions that wouldn't happen in nature. For example, you're not going to find someone who does heart surgery on themselves. Or if you take a medicine, that chemical or the compound itself isn't something that's naturally made in the body or occurs in nature. So you wouldn't have accidentally gotten it in your body if you weren't actively trying to test it. And so we can study what happens to someone when they take it. That's fine and well, but studies aren't always clean cut like that. This is one reason why nutrition studies are so hard to do. They have infinite confounders. But other times, the published results from other studies aren't what you're supposed to actually get. My friend Kevin, also known as Bobby Broccoli, recently released a full-length documentary named 17 Pages, which is about a single paper that sparked off one of the largest scientific controversies of the 20th century. It was dubbed the Scientific Watergate, and it caught the attention of the national media and US Congress. The results of the scientific misconduct investigation still reverberate today. And if you want to check it out, it's only available on Nebula. Nebula is a streaming platform built by and for independent creators, including channels like my good friends Medlife Crisis, Patrick Kelly, and Joe Scott. You get early access, no ads, and videos that are thoughtful and well-researched. Plus, Nebula has a lot of really impressive original content that can't be found anywhere else, like 17 pages. Come join us. Normally, this would be $6 a month, but if you sign up at nebula.tv/Chubbyemu, which is the link in the description below, you'll receive a big 40% off a yearly subscription, which is $36 for the year, $3 a month. And you'll get full access to the whole platform. And with your subscription, you'll get 1 guest pass per month, so you can share with family and friends for 7 days, and they won't need to share any payment info to enjoy. Scan the QR code or click the link below to start watching now. All of this to say, be careful of studies that get thrown out there. There's a lot of noise out there now, and you need to do your own due diligence to protect your own mind and do what's best for yourself. Anything that has to do with your body, please see a licensed professional. Never elect to do it yourself. Thanks so much for watching. Take care of yourself and be well.